DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show today. Dr. Garland Dahlke is joining us from the Iowa Beef Center. We're going to talk about beef, dairy cross cattle, some of the differences in production, some of the differences in outcomes. Really excited to have him on the show. Stay tuned.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I am joined today here at Iowa State University by Dr. Garland Dahlke. And most of you don't know, but Dr. Dahlke is the one, if you've used the Brands program to balance rations or to feed cattle or to feed cows and calves, this is the guy that wrote it. So pretty cool honor to have him on the show and have you with us. He's a research scientist for the Iowa Beef Center, which covers all of Iowa and the upper Midwest and more and more. How many years have you been with the Beef Center?
I've been 20 years with the Beef Center. Then I did a little time here in graduate school, so 6 years there. But there was a break in between. So
that's awesome. Tell me a little bit about what you do at the Beef Center.
Well, I guess I got hired back to support software. We have our Brands program, which I developed that. That was my project on the side. But we also had a lot of beef tracking, feedlot monitoring program stuff. And so I wrote the program and then supported it. And it's still being used a little bit, not as much as it had been in the past. Then ester synchronization software, and then a lot of odds and ends in between. So
yeah, and a lot of research.
A little bit, yeah. A little bit.
And the feedlot and so one of the things that you've been researching or have been working on too is with these beef on dairy cross calves.
That's right. That's right. And actually, I got my start with those 50 years ago when I was a little kid, because we had a dairy farm. And whenever we had cows that didn't breed well, we just breed them with an Angus bull. And at the time too, we had Guernsey cows, and that was phased out. We moved into Holstein, so a lot of our Guernsey cattle we bred with. We usually a Hereford or Angus, usually Angus, and then we were selling those calves. And there's a feed yard in Illinois that was buying them up and feeding them all along. So I was in on this from the ground floor, I guess.
So, you know, it's amazing to me because, you know, you hear those stories and you hear different genetics, you know, actually we increase our conception rates and things of that nature. But when we started talking about some of the production differences, when we get these calves at the feedlot, they've been raised quite differently than the beef calf.
That's right. Most of the time, quite differently. And a lot of times they're weaned onto a high grain diet, and they look, a lot of that is kind of short-term gains, I think, is what's being looked at. Some of them are like on a straight to a pellet, and then things happen in between, but they'll usually end up at a calf ranch and then to a feed yard, and their rumens really aren't developed as a traditional beef calf would be, and that does give us some trouble, I think, in the feed yard.
Yeah, and I think people need to understand that the beef on dairy cross, so the upper third of dairy cows are going to be used in milk production, are going to be used to propagate more dairy genetics. The bottom 2/3, 6 million dairy cows, are going to get crossed with a beef, either semen or a beef embryo, and then brought to our industry in the feedlot because they don't want to propagate those genetics, right?
That's right. That's right.
So pretty big infusion.
It is, yeah. Right now with the sex semen, it really is a big boost in these dairy cross calves, where in the past it was just kind of hard breeders became part of that pool. So it's a big deal right now. And then there's a lot of milk on the market. There's quotas being introduced. So there's even more and more coming on because of that.
And you know, we see the steer market being replaced. We don't feed many Holstein steers
No,
anymore.
that's a hard one to find these days. Yeah.
And but very interesting topic. Let's take a break, and then when we come back, let's talk about kind of starting them on feed when they're coming off of that grain starter.
Sure.
Thanks for watching Doc Talk. We're going to take a break. We'll be right back. More with Dr. Garland Dahlke.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today on Cattle Intel, our focus is going to be foot health. So foot health is critical for all cattle operations. You should constantly be watching for lameness and address any problems as early as you can. So when evaluating feet, start with conformation. Pay attention to uneven or excessive length, twisting, or even curling of one or both claws. It's important to look at the space between the toes. Any redness or swelling can be a sign of foot rot or interdigital dermatitis. If claws are too long or uneven, get them trimmed as soon as possible to correct any problems before it's too late. This is important for the whole herd, but it should be addressed quickly, especially in bulls prior to the breeding season. Dairy cattle, or cattle that spend a lot of their time on hard surfaces, are at a greater risk of early breakdown and should be evaluated and trimmed 2 to 3 times a year. Also, cattle that spend more time on irrigated pasture or excessively wet environments are at a greater risk of foot rot and interdigital dermatitis. Visit with your veterinarian to develop treatment plans and protocols for addressing lameness and feet health in your operation.
Thanks for watching Cattle Intel by Neogen.
I'm Jeremy McBride. I manage the ranch for Wilmoths here in Southwest Missouri. Probably the biggest challenges in Southwest Missouri is the weather. That's where the Therapies has helped us. The last day we got through weaning, it was 65 degrees and sunshine, and the very next day it dropped to 35 degrees, rained 2.5 inches, which is very, very hard on these cattle. And we doctored 2 heads.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thompson here with Dr. Garland Dahlke, and we're at Iowa State University in Kildee Hall, where Dr. Dahlke is a research scientist for the Iowa Beef Center. He's been with them many years. He has done so much for our industry on software development and research, and he was raised on a dairy and then came to the feedlot world and did research. So he himself is a dairy on beef cross.
I am. That's right. That's right.
So, you know, you've fed some of these calves out at our feed yard, but you know, when these calves are coming off of that grain starter, there are probably some different challenges than when we have calves coming off of grass or just straight off the cow.
Yeah, I think so. And I don't know, you know, a lot of times we talk about animal health and rumen health going side by side, and you always hear all these crashes and burns regarding feeding dairy beef, and I think that may be part of the thing because the rumen's really not developed as a beef calf would be, and I think that's one of the challenges, and I think that's one of the big steps calf ranches need to recognize if they want to develop cattle that are 1,600 pounds like we're feeding now. That's what we're in Iowa. That's kind of the outweight now, and these high energy diets initially give you a big boost, but if we look at Canada where they do the red veal, you know, they're selling them at 900 pounds.
Right.
And, you know, we still got another 700 pounds to go. So how do you do that? And I think we really need to look at this initial calf nutrition to work at that, to try and hit that final endpoint.
So when we see some of these calves coming in, I mean, when you throw a 50% roughage diet on from them, they're going to say, what the heck is that?
It is. There's some things I think we can do to help them. You know, a lot of times we talk about long hay and all that, and that's fine. But I think a haylage diet, good haylage, not just junk, not something off a compost pile, good silage, they seem to take to that a little better. There's flavor to it. You know, they like stuff that tastes good like us. It's a smaller particle size. They can eat more of it faster. I think that helps quite a bit. In some of the stuff that we're doing here at Iowa State, that's where we've kind of gone to a haylage, silage type of diet to get these guys started.
And you see them take it to it a little bit better, don't you?
They do. They take right to it. Day one, they're on to it. They're chewing their cud that afternoon. You know, it works pretty nice.
And that, you know, that kind of goes along with it's silage has always been that in between, half concentrate, half roughage. And so maybe it is a natural, and that shorter particle size, I bet, is easier to assimilate.
It is. I think that's a big deal for these little, because they have a small mouth, you know, and they can chew on its stem of hay all day and it doesn't really do much for them. Silage, they can take it in. But I think, you know, a lot of people get burned on silage in the past because they just didn't make good silage. I think that's maybe the big thing. And coming from a dairy farm, you know, we lived and breathed good silage. And I'm from up north, you know, we don't have dry weather, so we couldn't make good dry hay consistently. So that's just by default what we were on. But you learn maybe the hard way that you got to make good silage to make this work, you know. So
yeah, and I see those calves when we necropsy them, how thin their rumen wall is, because they've been handling milk replacers and this grain-based starter. They haven't developed that rumen musculature to really move the forages around the way they need to anyway.
That's right. That's right. Yeah, they're set behind a little bit because of that, and so we need to keep that in mind looking forward as we're trying to.
One other question then, you know, we build the rations where we step them up to more of a finisher. Do you also build intake to help build that rumen musculature?
I think so. I think it goes hand in hand. It works together. And I think the thing is, though, you use high quality feed for these little guys. I think that just drives everything else naturally. And we can't, like here at Iowa State, our dry forage is fescue hay grass, and it's kind of coarse.
Yep.
For fat cattle, works fine, but for these little guys, not so good. You know, so we've gone to like a rilage, which is very high quality, and they take to it and they eat and they just keep going, and it really helps. I think the cause makes everybody's job a lot easier.
It's awesome. We're going to take a break. When we come back, we're going to talk about the performance differences between beef on dairy cross and beef steers in the feed yard with Dr. Garland Dahlke.
Founded by farmers, for farmers, United Patriot Coin stands with you. Diversify your financial portfolio with precious metals, a smart investment for uncertain times. You've worked too hard not to protect your assets. United Patriot Coin, precious metals for a secure future.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Garland Dahlke, and he is the research scientist for the Iowa Beef Center. He has been a staple to the Iowa beef industry for over 2 decades, and tickled to get you on the show and spend some time with you and talk about something that's really kind of changing our industry, these beef on dairy cross calves.
Yeah, that's right. They are. They're the new kid on the block for
They
the
are.
most part.
And they're consistent. They have consistent genetics. They're raised somewhat consistently before we get them. Talk to me a little bit. You guys have done some research looking at different performances, and I know you do a lot of stats for the Iowa beef industry, but what kind of experiences do you see on the performance side of these guys versus beef calves?
Well, I guess sometimes they get a bad rap, and a lot of it deals with health. It's a big thing. So then it goes into your department.
That's right.
But when they're feeling good and growing good, they're really hard to stop. We've had some little trials here, like during COVID, we needed something to do. And so the farm manager here at Iowa State, he got a bunch of these dairy cross calves from the ISU dairy. We fed them, took them all the way through. We got them at 250 pounds, sold them at $14.50. We probably could have went to $1,500, but we had to make room for other animals. And we had a pen of heifers on their closeout. They did over 4.
Oh my gosh.
They really smoked it. We had a pen of steers. They were the mates to these heifers. They did 298. The difference was we had some chronics in that steer pen. And how do you get over it? It was mycoplasma. Maybe that's what the attending vet said it was. And you fight those all the way through. And I say when they're healthy, they're as good as anything out there.
We see that mycoplasma. If you have one of these beef dairy cross calves and they drop an ear, it's almost always mycoplasma. And we spend more time reading the ocular secretions out of the eyes and nasal secretions. And a beef steer, we kind of, we tough it out. But if one of these little dairy calves drops an ear or has that going on, man, get them in and treat them.
Yeah, they're little. There's not a lot of buffer there to hope they make it through, So
no, they're pretty fragile. And so when you step them up and they're on feed that long, do you take a little slower approach to step up, or do we take right after them?
Well, we kind of take right after them. I guess the diet, those, not maybe what other people have fed in the past. I say we feed a TMR, but it's, for the dairymen out there, it'd be like their high group TMR in terms of energy, protein content, bypass protein. And for everybody else, it's about a 56 megacal starting them out. And we get them right on right away. There's a lot of texture to it. We make them chew their cud in terms of effective NDF. There's not much long hay because, as I mentioned, we kind of like the silage and the shorter particles so they can just eat more. It's just more convenient. The other thing is we also were feeding these in a feed intake system so we can monitor intake. And long hay and that doesn't work quite so well because it's just the bulkiness and to get enough feed in the bunk. But the effective fiber was still running about 11% of the NDF being chewable fiber, and energy was at 56. The protein is fairly high. It was about 18% protein, with about 60% as bypass protein. So it's similar to what you'd have for a milking cow actually, and we got them on that till they're 500 pounds, and then from there we move them up the ladder a little bit. Then we go to about a 60 megacal diet, and then a 63, and they're out the door by 14 months.
So for Christmas. So what your finished ration then would be? What percent roughage? Or
it was about on an effective fiber would be about 4 effective fiber. So it's similar to any other feed steer ration. We're using a lot of byproducts. We're using some sweet bran and distillers grains, as our protein supplement, but nothing fancy really.
But when we can get these calves to perform at 4 pounds average daily gain and convert at 6.5?
Yeah, it was about 6. Actually, 6? The heifers were right at 6 on that. It was, I say, when they're feeling good and doing good, they do well. But then like that steer pen, we had a couple chronics in there. There it slipped.
That's when we blame the vet. Anyway, thanks for watching. We're going to take a break. When we come back, we're going to talk about carcass attributes with the Beef on Dairy Cross with Dr. Garland Dahlke.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had a injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road. Hey folks, Dr. Dan here. Welcome to DocTalk Season of Giving with Merck Animal Health. This week, we're going to give away the one and only Ryle-Gro implant gun. Never been a better implant gun invented. How do you win this? Go to our website, www.doctalktv.com. Just click Season of Giving, register for our newsletter, and you'll automatically be entered for a chance to win this Ryle-Gro gun. And if you win, we'll throw in a DocTalk cap with it. Thanks for watching, and we'll see you down the road.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Garland Dahlke, and we're at the Iowa Beef Center where Dr. Dahlke is the research scientist, has been in staple in Iowa beef production for many, many years, goes back to the work with Dr. Trinkle, who was a staple of the ruminant nutrition world, and you know, it's a pleasure to have you on the show.
Thank you.
Let's talk about, we talk about the bad rap, and then we talk about the funny shaped ribeye and different things like that, right?
That's
With
right. We hear
beef
about
on
that.
dairy cross calves. But what were some of the things you all saw if you were going to characterize a beef on dairy cross carcass?
Well, all these cattle we've fed so far have been sold on the grid, so that way everything kind of comes back at you. If you goof up, it's your fault. You win or lose. But the heifers that we fed in this group, we were 100% choice and above, with 37% of them come back as prime, and that was nice, and the rest were all choice. And I say they did quite well, and we got a nice premium from that. And they were all black too, and I think that's one of the things people complain about the most. If you got a white spot in the wrong place and you're selling into a Angus market, you get hit. They think you got a Holstein then or something. So all black is best when you sell them. With our steers, there we've done very well as well. And I say those that are chronics or not doing quite as well, there you're going to get dinged. So there you'll see a select, but those are not real good. They probably wouldn't have done, if they were a purebred Angus, probably wouldn't have done good either because they weren't feeling well. But those that do well, same thing. The rest are choice and above so far. That, like this one group that I'm kind of referring to, they were 71% CAB.
Wow.
So it was really nice. And then
Great.
It was really good. And a lot of primes, in that bunch, of course, as well. And they were, I think the average outweight was 1460. So they weren't humongous either. And they were only 14 months old.
Well, I know that when you see Angus semen sales over the last 8 years has just gone like this, and it's all going into the dairy industry. I don't think that many ranchers are saying, I'm going to increase my AI program.
Yeah, just out of convenience, I think. It's easy to grab a different bull out of the jar, and they're Angus now instead of a Holstein.
Yeah, and so you're getting the best of the best Angus genetics, and dairy cattle have always had a propensity to grade.
That's right. That's right. So it works very nice. And I think the eating quality is very well, just from growing up. That's what we ate. Yeah. And it was good. I don't think anybody would have a complaint about it. So.
Well, if they're taking 71% of them as CAB, which is our highest end market for the most part in the beef industry, that means that carcass is a pretty quality carcass.
That's right. That's right.
Cool. Well, I just want to say thanks so much for being on the show and sharing your information with us. Sure. Thanks what you do for the state of Iowa and for our beef producers as well.
Yep, no problem.
It's great. It's great. Thank you for watching Doc Talk. We had a great show today talking about beef on dairy cross steers and heifers. And if you want to know more about what we do at Doc Talk, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian and your local nutritionist. With Dr. Garland Dahlke, I'm Dr. Dan Thompson, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.